Okay, so hi everyone. My name is Michael McGrath. I'm with the Research and Evaluation Office of the Ministry of Transportation. And with me is Dr. Robert Mann, a senior scientist at the Center for Addiction and Mental Health. And we're going to be talking to you today about drug driving policies in the province of Ontario. And Bob's going to talk about a joint project between the Ministry of Transportation and CAMH that is investigating the road safety impact of cannabis retail outlets. And while cannabis has been around for many, many years, over the past number of years and recent years, there's been a particular renewed interest and focus on cannabis, especially since it's become legalized. And in the public policy and public health realms, this has posed some unique challenges as measuring the public health impact of cannabis has some challenges, to be sure. And as a government, we're trying to understand how we can best understand the size and scope of the problem and what needs to be done. So before we get into the specifics of the presentation today, I'll just give a very quick overview of what the Research and Evaluation Office does at the Ministry of Transportation. First and foremost, we evaluate policies and programs effectiveness of our road safety programs in the ministry. So recently, we evaluated all our drinking and driving countermeasures in the province to help support some new policies to target drug-impaired driving. And we also conduct applied road safety research and provide expert advice for our policymakers. And a third and really important thing that we do is that we develop strategic research partnerships with other academic and research institutions across the province and across Canada, such as CAMH. And these activities really extend the reach of our ministry into areas of research that we might not have the resources or the expertise to do. Okay, so back to the topic of cannabis. So despite the legal and health concerns around cannabis, it has long been a popular recreational and even therapeutic drug in North America. And some recent usage statistics suggest that almost half of Canadians report having consumed cannabis at least once. And over the past number of years, THC, the psychoactive ingredient in cannabis, has increased quite rapidly from an average of about 3% in the 1980s to around 15% today, and even sometimes higher for some extracts. The THC that you can find in cannabis today is not the same stuff as you would have found at Woodstock at the end of the 1960s. And in terms of road safety, in Ontario, almost 1/4 of tested drivers killed on Ontario roads in 2017 tested positive for cannabis. So we know that these drugs are showing up in fatal collisions and likely playing some role. Now, legalization in cannabis has been around since October 2018. Prior to that, medicinal cannabis had been legalized almost 20 years earlier in 2001. And while legalization is a federal issue, each province gets to set its own rules around things such as minimum age, where it can be sold, where it can be consumed, and possession limits. In Ontario, the Ontario Cannabis Store is the official online retailer of legal recreational cannabis. But this province has also authorized a select number of bricks and mortar retailers to sell cannabis as well. So what about cannabis and driving? Well, at the federal level, there are a number of penalties for driving impaired, whether by alcohol or drugs. This can include up to a decade of imprisonment, monetary fines, driving prohibitions, and it comes along with a criminal record as it is a criminal offense. But provinces and territories can apply their own sanctions or penalties in addition to federal consequences. And that's what Ontario has done in recent years. So this is quite a big chart about what the penalties are for impaired driving. But it's just to show that whether it's your first, second, or a third or multiple occurrence of driving, whether impaired by drugs or alcohol, the province has a whole network of different sanctions and penalties for these types of drivers. For commercial drivers and young drivers, the penalties tend to be harsher, but they typically include license suspensions, monetary penalties, and for second and third occurrences, education courses and ignition interlock programs for alcohol impaired drivers. Now, the policy idea behind such a complex network is mostly to target behavior at a number of different levels. There may be a financial aspect, there may be a social aspect, there's also a rehabilitative aspect as well. We know that one of the best things that we can do for drivers if they've been caught driving impaired more than once is to try and help them understand the source of this problem and provide them with tools to becoming a safe driver once again. Now in Ontario, building up this legislation network has taken a number of years. And recently, we've made some policy amendments to get to where we are today. Back in 2015, we applied our current alcohol impaired sanctions to drug impaired drivers, and we introduced some new measures for repeat offenders. And then in anticipation of cannabis being legalized in 2018, we introduced even tougher drug-impaired driving laws, including zero tolerance for young, novice, and commercial drivers. And in 2019, we introduced zero blood alcohol or drug concentration for driving instructors while they have students in the vehicle with them. Okay, so those are some policies that the province has implemented over the past few years. But how do we know that they're targeting the right types of risks? And how do we know whether they're working? Well, one thing that we do in the Research and Evaluation Office is we're always looking to collect relevant data. And the best way that we can do this is from a variety of different sources that monitor the impact of drug-impaired driving. In 2014 and 2017, Ontario conducted two roadside surveys. These are surveys where drivers are randomly pulled out of the traffic stream over at some select sites over a few weekends and evenings, and anonymously asked to provide some oral fluid and breath samples. And this type of survey gives us a really good indication of the prevalence in the general driving population of drugs and alcohol. We can also use attitude and behavioral surveys that are done every other year to get an understanding of how Ontarians perceive and act and feel about drugs and alcohol use. And thirdly, we have drug prevalence from fatally injured drivers. And this is toxicology data that's taken from the coroner's office. And it is quite high quality data on the most serious collisions in the province. But it's often on a very small population as well. But this data from the chief coroner tells us some things. We've been going there since 2011. And we can see that the number of drivers testing positive for THC fluctuates from year to year. But in recent years, it has started to trend at the very least above 20%. And we know that THC continues to be the most popular drug that fatally injured drivers are testing for. And it's more prevalent in young drivers, those under the age of 22. So that's some of the data that we in the ministry can collect using our own staff and our own resources. But we also know that establishing a number of partnerships in pursuit of stronger indicators and better data is actually the best approach that we can take. And so we have developed a road safety research partnership program that looks to leverage external resources such as driving simulators or particular research expertise to study impaired driving. I think the picture that I have on this slide actually might be the simulator at CAMH. And we know that by combining financial resources, we stretch our research dollar and fund way more substantive research that we could fund independently. And there's a list of universities and academic organizations on the screen here, as well as hospitals such as Sunnybrook, and of course, the Center for Addiction and Mental Health. And CAMH has been a key road safety research partner for MTO for a number of years. And I'm going to turn things over to Dr. Robert Mann now, who can do a much better job than I at explaining their ongoing research to investigate the road safety impact of cannabis retail outlets. Bob?
Thanks, Mike. Thanks for the introduction, and let me say that I'm delighted to be here with you today and with everybody, and that we are delighted to be partners with MTO and Mike and his colleagues in this work that I'm about to describe. So the project is called the Road Safety Impact of Cannabis Retail Stores. In addition to Mike and his colleagues at MTO, it involves several folks. The leaders really at CAMH and Western of the project are Christine Wickens and Evelyn Vingilis and Pat DeCiano, and involves, of course, myself, Tara Elton Marshall, Frank Ajic, Camila D'Souza, Andrea McDonald, and as well, Transport Canada is a participant in the project as well. So it's a complex project with some very important goals. So could I have the next slide, please? Thank you. Oh, I think one thing I should tell people, I think if we have time for a question and answer, I'm told that if you hover your cursor over one of our pictures, it will call up an opportunity to type in a question. You can't use the chat function, but you can use the question and answer function. So again, as Mike has mentioned, in October 2018, we became the second country internationally after Uruguay to legalize recreational use of cannabis. And of course, at that time and continuing from that, a major concern with the potential impact of legalization was the impact on road safety. And many believed it's possible that with legalization, that more people will use cannabis, and thus more people will drive after using cannabis, and therefore create more problems on our roads. So could I have the next slide, please? Thank you. So one of the policy relevant questions with legalization is, what is the impact of cannabis outlet density on road safety? So if we look at a parallel area, a lot of research has examined the impact of alcohol outlet density on road safety and other indicators. And that research has demonstrated that the density of alcohol outlets in a jurisdiction is an important determinant of the rate of alcohol-related collisions and injuries in that area. So we know that, and so it's therefore possible that the density of cannabis outlets may show similar relationships. This is important information for governments to know as they navigate this new area of cannabis policy that we find ourselves in. So to address this broad question, this research project pursues three aims. First is a systematic review of the effects of cannabis outlet density on collisions and other adverse outcomes. Second is to develop a database to support analyses of the effects of introducing cannabis retail outlets and the impact of cannabis retail outlet proximity on collisions and driving offenses. And third, to conduct preliminary analyses to assess the impact of the introduction of and proximity of cannabis retail outlets on collisions and driving offenses. And the pictures at the bottom There's one picture of a drive-through liquor store, which we don't have in Ontario, but some places do. And there's a couple of the picture in the middle, sorry, is a drive-through cannabis retail outlet. So this was apparently the first one that was opened, I think, in Washington State. So you can drive in, pick up your cannabis, kind of like at a McDonald's or a Tim Hortons, and drive off again. So that's an example of cannabis retail outlets. So could I have the next slide? Thank you. So the first the first part of the study was a systematic review of the effects of cannabis outlet density on collisions and other adverse outcomes. The initial draft of this review was done by March 2020. We looked at 8 electronic bibliographic databases for published papers up to February 28, 2020. 187 articles were initially identified, and of these 187, 6 met our criteria for including in this review. That is, they dealt with the topic that we were interested in. 3 of these studies, 3 of the 6, showed an increase in adverse driving related outcomes for states that had legalized retail outlets on some measure of traffic related outcomes. 3 other studies showed no overall effect, and 1 study actually showed a significant reduction in collision fatalities for those aged 15 to 44 years of age with the introduction of cannabis retail outlets. So thank you. We thought this information was, first of all, it was timely. We thought other people would be interested in it. So we have submitted it to a journal for possible publication. The journal has reviewers have reviewed the paper and provided us with comments. They've asked us to expand the search to include papers that published up to August 31st, 2020. We found 3 more articles with the 3 more with this newer deadline. So now we have 9 studies that met the criteria. Now, of the 9 studies now, 6 studies showed some increase in adverse traffic-related outcomes with the increasing retail outlets for cannabis. Again, 3 studies showed no overall impact, with that 1 study showing, in fact, a significant reduction in collision fatalities for those aged 15 to 44. These studies using difference designs, which is a type of research design where you compare differences in different areas that have experienced different things over time. Looking at total collision fatality rates by billion vehicle miles traveled or by cannabis positive results, found positive outcomes. That is, suggested that increasing density of retail outlets was associated with increasing road safety problems. So this paper has been revised and resubmitted to the journal. It's still currently under review. Could I have the next? Thank you. So the next part of the study is developing the database for examining the impact of cannabis retail outlet density in Ontario and the rest of Canada. So we have, of course, for a research project like this, we need approval of the ethical approval to conduct this, and we've had that since April 2nd, 2020. And we've been looking for various sources of data to find what might be accessible for this research. We had a meeting with Infrastructure Ontario to discuss possibly their involvement in the project, but that does not seem like it's going to turn out. Could I have the next slide, please? We've also been developing a database on retail outlet locations across Canada. We have a listing of retail outlet locations across Canada as of March 30th in 2020, and that's recently been updated for the next year's worth of research. We'll be adding postal codes. That's how we'll be geolocating the outlets. And we will be continuing with this data set. Could I have the next slide, please? So that's the cannabis retail outlets by province at the top as of March 30th, 2020, and the bottom graph as of April 8th, 2021. And you can see there's quite a bit of difference between provinces in the numbers, and also quite a bit of difference between provinces in the kind of the rate of growth, if you will, in retail outlets. As Mike has said, the provinces are determining their model, their retail model, including who gets to have a store, who controls the stores, and so on. And so different provinces have taken very different approaches. And you can see that in Ontario, we've had quite a bit of growth over the last year in the number and the proposed number of retail outlets. But there, of course, a fairly large number in BC and Alberta as well. And on a per capita basis, I think they would have higher rates of outlet densities than Ontario would right now. But the growth in Ontario is quite striking over the past year. Next slide, please. So we were also wanting to consider looking at quasi or non-legal outlets because we happened to discover, perhaps many people knew this before, but that there are websites, for example, where you can find out where cannabis is available. And these websites were available even before recreational cannabis was legal. I think nominally they were supposed to only be restricted to medical marijuana outlets. This is a recent snapshot of downtown Toronto, and you can just see the density of websites there. That's using a website called Weed Maps, and we investigated Weed Maps to see if we could use their data to identify outlets other than legal outlets. And quite interesting, really, when I remember looking at Weed Maps there, you can see the University of Toronto is there. And I remember seeing that there was a cannabis outlet, I think, in one of the residences at the University of Toronto. And I'm kind of assuming that there was an enterprising student putting himself through university selling cannabis. And they actually, they will tell you if they deliver or not. And this place delivered. So I'm assuming his roommate had a car. And so he was putting himself through university by delivering the cannabis his buddy sold. Anyway, we decided that these data were not sufficiently reliable for use in research purposes, and so we won't be using them. Next slide, please. So now we've really been embarking on a snowballing procedure to find databases that are geocoded for these analyses. And Stats Canada doesn't have geocoded data, impaired driving data, but we've contacted Vision Zero personnel personally in various municipalities and provinces directly, and have had some really good success there in identifying databases. Next slide, please. And again, thank you. So these are places that we have got involved in the project so far. Toronto, City of Toronto, and thanks to our contacts there, Jesse Coleman and Rachel Saunders. City of Hamilton, thanks to Rodney Atchison and Khaled Kawash. City of Calgary, thanks to Daniel Lepchuk. City of Montreal, thanks to Bartek Komorowski. And and British Columbia, the province of British Columbia, thanks to ICBC, and our contact there is Mark Milner. So these folks, we already have our initial batch of data from these areas, and we're working on a data licensing agreement with ICBC to get their data as well. Next slide, please. So we're contacting other jurisdictions as well. For example, cities like Edmonton and Halifax, and provinces like Manitoba. And we anticipate including additional participating jurisdictions in this project as well. And next steps, we will be updating our collision data. We're getting 2020 data from cooperating jurisdictions. We're pursuing data from additional jurisdictions. And we are looking at, can we collapse the data sets across jurisdictions, or do we have to do jurisdictions analyses on jurisdictions separately? We'll be updating our retail outlet location data on an ongoing basis. Next slide. And we have other data that we are accessing or have already. We have data or looking for data on self-reported cannabis consumption, driving under the influence of cannabis, and other relevant substance use and sociodemographic measures for relevant years from available sources, from sources such as the CAMH Monitor survey of the Ontario adult population, the Ontario Student Drug Use and Health Survey, which we run at CAMH. We've got a large Statistics Canada data set with sociodemographic data geolocated by forward sortation area, Health Canada's National Cannabis Survey, the Canadian Tobacco, Alcohol and Drug Use Survey, and the Canadian Community Health Survey. Next slide, please. So we will be conducting preliminary analyses probably next year when we've created the data set, when we finalized really our data set, and we'll be looking at the extent to which changes are associated with locations of cannabis retail outlets, changes in road safety indicators, and assessing if neighborhood characteristics may moderate this impact. Next slide. So we're in the thick of it. This is really, I think we think it's an important policy relevant project. Delighted to be working with all of the partners that we have in this work. And final slide. Thank you.
Great. So thanks a lot, Bob, for walking us through that presentation. I believe we're just about at time, but let me see if we have any questions here. I don't know if we have any questions open, but if anyone has any, then... No, I don't think so. Okay. All right. Well, thanks a lot, everyone, for tuning in. And Bob, thanks for walking us through that project.
Thanks, everyone. Good to be here with you today.
Yeah. Take care.
Take
Bye
care.
now.